Hey, everybody. Welcome back to another episode of the Family Business Podcast. This is going to be a fun episode. We get to talk to a surgeon, and I think that is absolutely wild for me. And I got so many questions. So I'm going to let Cassandra, do the intro, let you know what's going on.
Welcome, everyone. Today we have Dr. Clinton Kemp, cardiothoracic surgeon, husband, father. He is a chef and car enthusiast, and recently I seen him dabble into drones. So here we have our special guest. I'll let him introduce himself, and then we'll get started.
Excellent. Well, thank you very much, Cassandra and Jerome, for having me on. I'm Clint Kemp. Been here for 10 years, originally from Lancaster, Pennsylvania, Amish country.
Okay.
Beautiful place in the world to grow up. And my wife, who I met in medical school, used to be in the medical corps of the Navy. And so we were up in the Baltimore, D.C. area. And as often happens with the military, which I know you guys know as well, we get moved around. And so when it came time for Jean to get another assignment, our choices were either San Diego or Norfolk. And my kids actually are kind of sad that we didn't choose San Diego because San Diego's beautiful. But for lots of reasons, we ended up coming down to Norfolk. And, and one of those things where life just has a way of working out. One of my former resident partners up at Hopkins, Christopher Barrero, who you know very well, was in a practice here, and they were looking for somebody. So the stars aligned, and we came down to Norfolk. We've been here 10 years, like I said. Jean had 6 years left on her Navy commitment when we came down, and none of us had ever really been to Norfolk before. I mean, Jean had come down here for a Navy rotation growing up on the East Coast. We passed by Norfolk going down to the Outer Banks and things like that, but really hadn't given much thought to it. And so we moved here, gave it some time, and it was pretty clear that Norfolk was an amazing community to live and raise kids and everything. And so even though she's since gotten out of the Navy, we decided to make it home, and it's been great.
I love this area. It's really family oriented. Like it's kind of built to be a area to raise a family.
Absolutely.
So I do love that about this area because we're originally from New Jersey.
Okay.
And so going back to Lancaster, is that where the MEPS is at, or close to where the military processing?
There might be something there. My guess is that's probably closer to Gettysburg or Harrisburg.
Harrisburg.
Yeah.
It's Harrisburg.
Yes, Harrisburg.
But I remember when you said the Amish country, because when I went to MEPS for the military, I had to drive all the way to Harrisburg.
From New Jersey.
Oh, yeah. And I remember going through like Amish country to get there and being like, oh, they really on
the people
on horses and stuff.
It's totally true. And it's interesting. My dad went to law school in Philadelphia, and he's from the Midwest and just did not want to live in a city. So he and my mom moved to Lancaster in 1978. And at that point, it was really farmland, right? Okay. And it was sort of the beginnings of suburbia. So growing up, I won't say, I had a horse and buggy, but it was fairly rural, certainly compared to today's standards. But what's just amazing is how much that's grown up. Yeah. My parents lived there for almost 50 years. They've since retired to Florida, but the last couple times I've gone back, I cannot get over how busy of a place it is. It still has sort of that hometown feel. Great place to raise a family. Really close to a lot of major metropolitan cities and everything. But like everywhere, it's just growing and growing and growing.
Right.
Cool. So I don't want to take
go
over.
Ahead, go ahead.
But I am so I got so many questions.
Please, that's why.
So many questions about it. Yeah. But I want to first ask you about childhood.
Sure.
Right. So growing up, did you know like I'm gonna be a surgeon, or were you kind of? When did you figure out I'm gonna start opening people's hearts up? And stuff?
Sure, that's a very good question. So I think we're oftentimes influenced by our parents and what's going on. And what's interesting is nobody in my family's in medicine.
Okay.
My mother was an English teacher. My father was a lawyer, and both of them very happy with what they did. But I just seeing what they did, I knew I didn't necessarily want to do what they did. And it was really in school, in lower school, And in high school, it really cemented my love for biology and science. I still remember Mr. Bingham, one of my favorite teachers. In ninth grade, we studied biology. And it was the first time I had heard about molecular biology. I mean, you hear about DNA and things like that, but learning about the cell, learning that we have chemicals inside our body that have a code, that we have proteins that are enzymes that can do things, and how all that synthesizes into, the simplest organism like a bacteria or, a complex human being, it just blew me away. And so I knew then I needed to do science. And in college, I kind of got a little bit more interested in research and also in some aspect in medicine as well. Never really had any major medical, problems or, situations myself, but certainly had some friends with childhood cancer and watching them go through that journey. And when I got to college, I continued the molecular biology pathway, and I loved research. I absolutely loved, asking a question, forming a hypothesis, sitting there at the bench, doing that. And again, it just sort of blew me away that we're doing research on things that we can't see, and we have to use all these proxies, Western blots, Northern blots, enzyme reactions to prove a point for something we can't even see. And so I went down that pathway, and I think I could have had a very happy and fulfilling career as a research scientist in molecular biology, but I was missing one thing, and that's the connection with people. I've always loved, being with people, be it on a sports team, debate club, anything like that. And I knew that whatever job I wanted to do, I was going to have to interact with people. So that sort of, pushed me on the path to medicine. And I'm certainly glad I did that because I'm very happy with what I'm doing now. But to answer your question about surgery, going to medical school was probably the first time where I really, really enjoyed what I was studying. Not that I didn't love my history classes and all those other things, but medical school was the first time where I said, I'm learning something and it behooves me to learn it because I'm going to use this for the rest of my life. And between the interest and the sort of investment in my own education, that got me really, really into it. And I was one of those medical students who was happy on every rotation. I'll tell you, one of my favorite rotations was psychiatry. I don't want to do psychiatry, but, I absolutely am fascinated by the mind and, what can go wrong with it and how to help people. And I had a mentor in medical school, one of the deans, that said, okay, by this point, I guess I had decided I liked to work with my hands. I liked solving problems and doing things to fix them. And he told me, he said, I've seen people like you who want to go into surgery, who just get so laser focused that they don't pay attention to the other things. And that combined with one of my general surgery mentors, they both said, look, I want you to approach every rotation as if that's what you're going to do for the rest of your career. And it was the best piece of advice ever. So even on pediatrics, and I love kids, and we'll get into kids in a minute, I'm sure, there's no way I could be a pediatrician. God bless the people that can do that. I just can't do that. But, approaching a rotation like that, as if that's what you're going to do, I think gets you the most out of it. And I mean, I won't say medical school was fun. It was difficult, but I enjoyed it. It was a nice sort of hard push. But when it came down to it, I think in medical school, you kind of have to decide, do I want to be a proceduralist and do things? Or do I want to be more of, not a generalist, but, internal medicine, pediatrics, things like that, where you're solving problems and whatnot. Yeah. And I actually really enjoyed my internal medicine rotations too. But what I didn't like was, we diagnosed a problem, but we couldn't necessarily fix it. Right. We're treating chronic problems, which is clearly important. I mean, we need doctors and nurses in every single aspect of medicine, but I wanted to be the person who could actually fix something. And so that sort of naturally led me towards surgery. Initially, the way it worked at Vanderbilt was that in between the summer of your first and second year, you had to do some sort of research project. We all stayed on campus, and there was an opening in the cardiac surgery research labs. And I had actually, in high school, shadowed one of my friend's dads and dad's friends who was a heart surgeon, and I had no idea what I was looking at. I was in the operating room. I now know it was probably an aortic valve replacement based on remembering the sutures and the guides, but it was just fascinating. It was just absolutely fascinating, and didn't think much of it, again, until that summer between first and second year. And the lab was set up where the surgical residents who were in cardiac surgery were doing research. And as is true in all aspects of medicine, you have mentors at many different levels. So the attendings would mentor the fellows would mentor the residents would mentor the students. And I got to do things like go on a transplant procurement run and help out in the lab with real experiments, and just got very, very interested in it. And as with a lot of things in life, sometimes interests change. And unfortunately, my mentor ended up leaving Vanderbilt, and so the lab shut down. And so I didn't really have a mentor at that point. I knew I wanted to do surgery, and general surgery, you can go into almost anything you want to after that. And so I did the same thing, and I sort of found another mentor who was really interested in surgical oncology. And I thought, this is interesting. It's helping patients with cancer. It's bigger operations that are complex. This is what I'm going to do.
Right.
And so when I applied for residency, that's what I was going to do. I was going to be a surgical oncologist. And in general surgery residency, you rotate through all the different specialties that you can finally, finish up in. And although I like surgical oncology, we had rotations in cardiac surgery. It wasn't a surgical rotation, but it was actually in the cardiac surgical ICU. And being put in there as an intern in a PGY2 that is very daunting, because you obviously know taking care of those patients too. They're the sickest of the sick. And
PGY2.
Postgraduate year 2.
Okay.
Yep. Sorry. I'm so sorry.
I'm trying to.
Non-medical.
No, that's okay. That's okay.
ChatGPT, help me out.
Postgraduate year 2. So you really know just about nothing, but you're starting to soak it all up. And it's the physiology. And I think that's probably also why you love cardiac surgery too. The physiology of the heart, what's going on with these patients, what's going well, what's not going well, how can we fix it? I fell in love with that. And so I knew after that first rotation, this is what I need to do. And then the rest is history. Yeah.
Wow. It seemed like throughout your life, it kept bringing you back to cardiac surgery.
Yeah, it really did.
Like you said early on, when you shadowed your friend's dad's dad in cardiac surgery, even before you even knew that's where you were going to end up. That's where it pulled you.
Well, and in high school was when ER and Chicago Hope were on. I know everybody knows ER, but actually I think Chicago Hope almost was more influential than ER. I mean, we all know Eric LaSalle. He was the cardiac surgery resident in ER, but Mandy Patinkin played a cardiac surgeon also on Chicago Hope. And between both of those, I just thought, this is really cool. Now, obviously, that's highly fantastical, and it's not really the way real life is or everything. I mean, it's certainly no Grey's Anatomy, but I really like that. And some people like being around sicker patients and taking care of difficult problems. I'll tell you, my wife Jean is also a physician, and she and I could not have different jobs. She's a pathologist, so she looks at specimens under the microscope and diagnoses disease, and she's further subspecialized into skin pathology, so dermatopathology. So our days couldn't be more different. I'm at the hospital at 6:30 in the morning, signing a patient in or doing ICU rounds in the OR all day, sick patients, and Jean gets up, has a nice cup of coffee, makes sure the kids get off to school, goes to work, and she works hard. I don't want to say that she doesn't, but her slides aren't dying in front of her. So if she wants to take a break and have some lunch or do something else, she can. And that's one of the things that I've tried to show my kids as well. There's lots of different aspects in medicine, both in terms of positions and in terms of what you treat. So they've really seen sort of the two polar opposites. There's as this weekend was very much appropriate. I was pretty much in the hospital all weekend, whereas my wife got to play tennis, hang out with the kids, and all that kind of stuff. So there's lots of different things you can do.
Well, that's cool that y'all have that. Kind of that balance, like somebody
we need to.
Somebody needs to be able to relax.
To be more flexible.
Because like we talk about, like when me and her first got into our careers, I was a police officer and in the military at the same time.
Oh wow!
And she was a nurse, and so it was like constant. Just go.
Yeah.
And now we're finally able to be like, chill. And so it was really tough.
Yeah.
I mean, I think after a few years, I ended up going to the police academy, becoming an instructor there for my last couple of years. And I was able to be the Monday through Thursday, weekends, holiday off. So we was able to relax a little bit.
Crazy schedule.
And then she had the crazy schedule. And she'd be looking at me like, what are you doing? Like, Hey, you got work hard. You can play. You can.
That's
can
right.
chill a little bit.
I think you hit the nail on the head. And, you really need a good partnership. And I certainly have friends where, they're both nurses or they're both surgeons, and that's a lot tougher.
Yeah.
Jean and I sort of divide things up, and she takes care of the family way more than I do. Now, whenever I can, and it's certainly better now that I finished training, I do all the things that I can do. But if it weren't for my wife doing all of the things outside of her busy day job, our kids, as I always joke, our kids have clothes on their backs and they're fed and they're on the right buses and things like that because of that. But it really is a partnership. It's sort of a third job for both of us, right? Because we have our relationship, we've got the family, which is the third job, and then our two busy careers. But I honestly wouldn't have it any other way.
Absolutely.
Yeah.
That's very well put. We like to emphasize in our relationship podcast is the intentionality in the relationship, prioritizing each other before our careers, and then obviously our children. Well, our one daughter that we have, but if we're not okay, the trickle down effect, everything else will not be okay.
Yeah.
So you said it beautifully.
Yeah.
It's really interesting too how kids pick up on that.
They do.
I mean, in any relationship, it's not all just roses, right? There's times that are tough. There's times where you're mad at each other. There's times where you should be mad at the other person or vice versa. But, I think trying to set an example for our kids about, mom and dad love each other and we're a family and we're going to do things together, I think is key. I, again, have to give my wife credit during residency. So her residency was shorter than mine. So she finished up before I did. And so her time got, she had more free time before I did.
Right.
But she had a thing when we were back living in Maryland. On Friday nights was movie. It started out as pizza and movie night, and then once the kids got older and could sort of pick what they want, it's we took a turn, and all four of us. So in a month, everybody got a weekend, and that Friday night that was yours, you got to pick your movie, and you got to pick what we ate, right? Whether it was Chinese or pizza or Italian, whatever you wanted. And it was funny at first because my kids now are 17 and 14, but at that point they were 3 and 6, right? So when they started getting into the older age, my son wanted to watch the more advanced cartoons, and my daughter wanted princess movies. So there were oftentimes fights, but we certainly watched Tangled and we watched Moana more times than I care to remember, and we watched the entire Star Wars series as my son got into that. But it was kind of fun. We got it all together. And then more lately, now that the kids are older, we don't necessarily do the movie night as much anymore because our kids are too cool for us and they're doing things for their friends on Friday. Yeah, they don't want to do that. But Sunday night, and this is something that I did growing up as well. I was fortunate enough to live close to my grandparents, so every Sunday night we had family dinner. Right. So typically we had gone to church the day before, earlier on in the day, and then everybody would get together for Sunday night. And it wasn't like we put on a tuxedo or anything, but, we dressed nicely. We ate in the dining room, mom would make a nice meal. And so I've tried as much as I can with my schedule and with our kids' schedule to do that. And my wife's father is now living here in Hampton Roads with us, so he'll come over. So it's usually the 4 or 5 of us, and it's just kind of a nice time at the end of a weekend, which can be busy with sports and school and all that stuff, and work certainly, to just kind of sit back and realize what we're thankful for and just spend some time. And then if the kids don't have crazy homework or I'm not getting called back, we'll play a board game or something like that, which is fun. Yeah.
That's cool to find that time because we do what we do with our daughter. Our daughter's 15, and she does not like hanging out with mom and dad that much anymore. It's like she likes her own space. Give her iPad, give her space, her room. But we make it a thing to be like at least once a week we're going to sit down and watch a movie. And we
that's great.
Pick a family movie, do something together. But we always make that intentionally, like, let's do this family movie or something. And it's getting harder and harder because she does not want to watch what we watch.
I know.
It's it's her own thing. So we're like, hey, like the other day was Sunday. We was like, all right, come on, it's time to pick a movie. And usually it used to be like easy.
Sure.
But now it's like, nope. I don't like that. I don't watch that. She's like, that's for kids. That's babies. And then we like, what do you want to do? Like,
it's funny now because my daughter and my wife are big into horror movies. I'm so into them, but my son hates them. My son is big into sci-fi and big into sports, and of course my daughter doesn't want that. So we have that too. But we say, hey, these are the rules. You know, we watch this movie for you, Lucy, so we're going to watch this movie for you, CJ. But I think you raised an interesting point too. There are times where I know all four of us are in the house and we're all four doing separate things.
Yeah.
and I get it. I remember what it was like as a teenager. But I think, you know, seeing my son, and actually this summer I'm so proud of him. My kids have gone to a YMCA camp down in North Carolina for the last 10 years, and both of them have always had the goal of being a counselor. And last year, my son was 16, and so he was a counselor in training, right? And this year, he's actually a counselor. And it's been really fun watching him kind of go through it because we get the sort of play-by-play and things like that. And I'm never going to forget the first thing he said. The first week at camp is the youngest kids, so 6 to 8-year-olds, and they're away for a week, right? Which I don't think I could have done that at 6 to 8. No. I mean, I went to camp at 12, and that was early enough. And I said, well, how's it going? He's like, oh, the kids are having fun. And I said, well, what do you think about it? He said, these kids just don't listen to anything I say. and more importantly, I'll tell them not to do something and then they'll do it. And my wife and I just laughed so hard because, you know, we're like, yeah, buddy, that's just like being a parent. This is exactly what's going on.
It's
but
funny.
It's going to be a great experience for him. I think both in terms of leadership skills and also learning how to, you know, work with people and deal with difficult situations. It's been fun watching him do that.
Yeah, that's really where you really learn, like, once you be put in a position where you're now the teacher, that's when you learn, like, oh, this is what my dad been saying this whole time. So that's gonna be a great learning experience for him.
Oh yeah, and it's been fun watching my daughter too. Her latest thing that she's into is volleyball, and both of my kids, when they're into something, they go all into it. And so it started with middle school volleyball, and then she said, a lot of my friends are joining a club team because there's lots of club teams in Norfolk and Virginia Beach, and so we said, sure, let's do that. And so she joined a club team. And I didn't realize how much of a commitment that was.
That's a lot.
Both for the girls as well as for the parents. And, it's 2 nights a week from 5:30 to 8:30 going out to Virginia Beach. We live in Norfolk, so it's, half an hour each way. And then she still has homework. We still have, dinner to make and things like that. And then pretty much every single weekend there's a volleyball tournament. But I'll tell you what, it was so much fun to watch those girls, coalesce as a team. And I saw it, I guess she played 2 years in middle school and it was pretty much the same crew. So we saw them grow in their skills and their teamwork and things like that in the middle school team. And then this was the first year she did club, and watching those girls from when they first started to the last tournament of the season was just phenomenal. And it's so great to see them learning teamwork, learning the game obviously, and the skills and everything else. And again, while I spend every weekend in the winter that I'm not in the hospital inside a volleyball arena, it's just so much fun to do.
That's awesome. I love, we grew up doing sports as well, and I think it taught us a very valuable lesson. Like you said, the teamwork, just the camaraderie that you have, the sense of pride, and even leadership. Like you become a leader within your team, and you become their cheerleaders because you have to cheer your teammates on. Not a stroke.
Pretty far to call a stroke alert here.
Cheering your teammates so that you all can perform to your best I think that's like at some point every child should do some sort of team activity, and whether it's a club, whether it's a debate team, whether it's some sort of group thing, I think that every child should go through that.
And I coach track. And,
great.
I love when I see my students, like, at the beginning of the season, and they come together. They got that, the phases of team building. You start seeing them form, conjoin, norm, whatever, and it's so cool after like year, I have a student that's like, all right, this is his first year, and then I see him his third year, and they just like blossom into
you see the progress.
Like, it's so cool to see. And I've been doing it this is my 4th year at this school, and now I'm getting to that point where like I've seen some of these kids from the beginning to the end. And I mean, it's just so cool to see their transformation when they stick with it. And some of them, like I had a student this year, when he started, he was this small kid.
Yes.
Small kid. And then I seen him when he came this year. I was like, that's not him.
That's right. It can't be.
That's not him. And he became a beast. Like he killed it this year. And it was like, to see him, I'm like, wow.
Yeah.
That's progress, and that was hard work, because he always showed up. He'd just be the happy little kid in the back, never really got to participate at the track meets and stuff. He was just small. But he had that transformation, and so it's really cool to see that, and hoping they stick with it throughout the years. And I like to keep up with them, because I also do like mentorship and stuff like that. So I have a mentorship.
Coaches are very important mentors. I will tell you. I mean, I remember every teacher I had, but I remember every coach I had too. And, like with most things, even, in medical training, there's things that you take away positively and negatively from each of them. But you learn, right? You learn. I was fortunate enough to go to a small enough school that there was a no-cut policy for sports, which was also good because I'm not the best athlete. But our school, essentially made you do something after school every single season, right? So it could be sports, it could be band, it could be orchestra, chorus, whatever you wanted. But having that extracurricular, I think, was really key. And the lessons you learn, whether it's on the soccer field or, the track stadium or the tennis court, you just learn so much about yourself and about life and things like that. And I also think it's very important, especially in today's day and age, where kids are pushed so hard in school. I think it's nice to have an outlet. And I loved it too, because I knew at 3:05 when the bell rang, I was on the soccer field, I was on the basketball court, I was on the tennis court, and I could just forget about things for a bit and literally blow off steam. And I know I can see that in my kids too. I mean, they're tired when they get home from practice or orchestra or whatever, but it's nice for them to have something so they can, put away the studies for a couple hours before they come back and do homework. Yeah,
and you want to get home and be tired. It's like our puppy. We got new puppy.
Oh,
and
fantastic.
It's like, if we don't tire him out, he's all over the place.
Yeah.
So it's like, all right, I gotta take him for a walk. I gotta take him for a jog with me. If not, it's over. But when the minute you tire him out a little bit, he gets his day. He's
calmer.
He's calmer.
Listens to do everything. So definitely you need that time to blow off some steam.
Tire your kids out.
You have to. Yes, you absolutely have to.
Chess club, something to get their mind and body going. Yeah. So now I want to get into, I got questions about surgery.
Oh, sure. Let's do it.
So do you actually be like being a mechanic on humans? Like you really...
Yeah, it's pretty much what we do. We open the hood and we change valves out and reroute things and things like that. Absolutely. Yeah.
Give me a day in your life.
Day in your life.
Like you about to go
surgery.
You about to go fix this.
Yep.
BM Human, the BMW BM Human.
BM Human, that's right. So a typical day for me, I usually get up before everybody in my family, which is nice because I get my peace and quiet. I can have my coffee, shower in peace, all that kind of stuff. I live close to the hospital, which was by design, both because we love the neighborhood and, for what we do, sometimes you need to be in the hospital quickly. So, I get up usually around 5:45 or 6, and I'm in the hospital by 6:30. And I usually start my day off in the pre-op area. So usually the day, actually I'll start the day before. I'll look through all my cases or my clinic for the day. So I kind of have in mind what's going on. And then getting back to the, partnership, I'll tell my wife, I've got a big day today. Or, I've got clinic in the afternoon so I can, go pick Lucy up or go do this with CJ or whatnot. But so I kind of have an idea when I get up what the day is going to be. And most days, like I said, get to the pre-op area about 6:30. I think it's really important to talk to your patients pre-op, and I'm not saying other people don't, but especially in what we're doing, we do this every day. I won't say it's routine because I hate when people say things are routine, but this is my job and I do it every day. But that patient, this is oftentimes the first, maybe only time they've had surgery, and it's not a small surgery; it's a big surgery. And so I think going and meeting with them, meeting with with their family, even praying with them if that's what they want to do, really helps to not only get my day started, but also make them as comfortable as they can be for a very scary procedure. And then typically I start my rounds in the intensive care unit, which you know very well, where we have the sickest of the patients. And that's for a couple of reasons. One, oftentimes you need to put plans in place early in the day so that the day progresses. And other times, sometimes, you find that there's problems that you need to address sort of in an urgent fashion. Usually we'll have a meeting then between 7 and 8 o'clock, and then get to the operating room about 8. Most days we do 2 cases a day, as our cases tend to be a bit more lengthy, or I'll do 1 case in the morning and have clinic in the afternoon. People always ask, like, do you have time to eat lunch and things like that? There are times to do that if you want, but, oftentimes we're just so busy. We don't, but, there's time to take breaks and then, just go to the operating room. And I like my operating room to be, as calm and, professional as possible. So I know a lot of people play music, or they ask, what music do you play? My patients will.
That was going to be my question.
Yeah. So I don't like that, because I like I like extreme focus. And there's others that, they need that music on in the background, or they need that to sort of lighten up the mood. Everybody's different, but for me, I like pure silence, except for when we're speaking and when we're doing things, so I can just focus. And then it really depends on what kind of operation we're doing. There are ones that are, more routine, ones that we do a lot of, or ones that are less complex. And that goes all the way up to, some of the most complex operations where we've planned this out. We've talked to partners. We have partners help us out. My patients also ask, how many people are in the operating room? And I describe everybody in the room as kind of my NASCAR pit crew, meaning I've got somebody that helps out with everything. And, the patients will oftentimes, just thank the surgeons, right? And I say, well, no, I appreciate that you're appreciative of what I did, but I can't do what I do without everybody here. And that's, I know you met the people in the office. You're going to meet the people in the operating room. And it literally takes a team of about 8 to 10 people just in the operating room to do these types of operations. Right. Because we have, obviously the surgeon, his or her assistant, the surgical technologist who's handing instruments, the circulating nurses who make sure everything is flowing, someone called a perfusionist who runs the heart-lung machine, not to mention the anesthesiologist and all the techs that help out with labs and, fetching supplies and things like that. And it really does take a village. And, the difference between heart surgery and a lot of other surgeries is time is of the essence, because you can't have the heart on the heart-lung machine for any longer than you need to. And for most of the things that we do, we have to stop the heart. And we give the heart nutrients to be able to make sure that it's going to be able to come back again. But you don't want to dilly-dally. So, obviously nobody rushes, but it has to be very coordinated. And that's one of the things I love about it, is that it is complex. You sort of are on the clock. And there's a series of steps that you have to take. And that's why it takes so long to go through training, is it takes that long to figure out the steps. One funny part about that, when we were still up in Maryland, my wife, I think, as I mentioned, her training was a little shorter than mine. And so she was an attending already. That's somebody who's finished training and is practicing on their own. And I was a fellow at that point. I was in my last year of fellowship. Fellow. So there's medical school, there's internship, which is your first year after, and then there's residency, which are your subsequent years. And then if you decide to go into a specialty like cardiac surgery or plastic surgery or things like that, you do a fellowship just in that area. And I was trying to explain to my son, that mom wasn't attending and dad was still a fellow. And of course he was, 7 to 8 years old and couldn't understand it. And I said, oh, I know, I get it. I said, I'm still in school. And he looked at me like, but you're my dad. And I was like, yeah, I know, but you're older than I am. And so kids ask the funniest questions. He said, well, what grade are you in? Right? He was in first grade at the time. So I counted it up, and as a chief cardiac surgery fellow, I was in 30th grade.
Wow.
30th grade. So I said that to him, and I saw his eyes get about that big. And I was like, well, you don't have to do that, right? There's lots of things you can do. Yeah, he's thinking like, my
I'm
goodness.
never getting out of this school
That's
thing.
right. But, big roundabout way of saying, it takes a long time. But, the advantage of that is you have a lot of years and a lot of experience under your belt. It still doesn't mean that you don't learn something new every day. Right. I've been, in this job for 10 years post training, and I still learn something new every day. You have a scenario that comes up that you didn't expect. And much like a pilot or a police officer, the reason you do all those trainings is for the situations that you never thought you'd be in.
Right.
Yeah.
No, that's cool. But people always say it doesn't take a rocket scientist to figure that out. I don't think it's that hard to be a rocket scientist. It's not that hard. But to be a heart surgeon, that is different. Like a rocket scientist doesn't have to be like, we got to do this right now. It's like you can, all right, this is how much gas you need. It's going to go into space.
Yeah.
But the heart has to stop. You got to do this and that.
Yeah.
And you have to do it right there. That is way harder than some rocket scientists.
I personally think so too, and I also think, by the way, one of my pet peeves is everybody thinks that neurosurgery is the most complex, and it's difficult. Don't get me wrong. But with heart surgery, not only is it very cerebral, you have to be thinking of all the things that are going on and what could be going on. It's very technical. When we operate and we do, coronary artery bypass grafting, you have a blockage in a heart artery. You've got to, somehow take a vein from a leg or an artery under the chest and reroute the blood. That's some of the most, fine, complex surgery that we do. And yet to do that, I have to take a saw and open somebody's chest, which is about as, unfine and unrefined as possible. And so it's the combination of both of those that I love. One moment you're thinking medically, you're thinking, strategy. Another moment, it's, literally taking a thread that's smaller than a human hair and connecting up two arteries. And, not to put any pressure on you, but if you do that wrong, a patient could die.
Yeah.
And that's, it puts a lot of pressure on you.
And everybody's looking at you like, what did you do to my family? It's like, I couldn't get the hair inside the thing.
Right. Exactly.
I'm sorry. I don't know what to tell you. I've tried.
But I enjoy the challenge. And, obviously, all of us have good days and bad days. And there's patients that, it's a relatively simple case, but something happens, right? And even in the best laid plans, in the best hands, the best scenarios, things can happen. And that's what's still tough. Yeah. You obviously, you go to work every day wanting to help people and you give it your best and you do your best, but sometimes things just don't go the way that were supposed to. And that's tough. That's tough. I mean,
I know people probably don't think about the trauma that comes, like afterwards, the emotional baggage is like you tried, you're working, but everything isn't, it's not 100% success rate on everything.
Oh, absolutely. And it is very difficult talking to a patient's family member when something bad happens. There have been times I've cried with the families because, I put just as much time into that as they did putting into worrying about them. And, seeing the look on their face of obviously I'm very disappointed at what happened, but I can see, the sweat on your brow, the fact that I know you've been in that operating room for 8 hours, that you told me this was an emergency. And if we didn't go right to the operating room right now, there would be no chance. It really does take a toll. But I'll tell you, one of my mentors in training said that he kept a folder with all of the cards and thank you notes and things like that that he's gotten. And when he had a rough day, he had a bad outcome, something happened that he wasn't expecting, he would go back and just read one or two of those cards. And so I do the same thing. I have them in my office, and it ranges from the, patient wrote the letter themselves to one of my favorite ones was a really sick patient who had a child. He was thinking like he must have been 7 or 8 based on the artwork. And the patient did well and he got through it and he was very sick. And the thank you note was his 8-year-old who drew me a picture saying, "Thank you for fixing my daddy's broken heart." And it's amazing,
Put it on a Valentine's card.
Exactly. Exactly.
That's nice.
Yeah, but I mean, those are the kind of things I think that you need to do to remember why you did what you did. Because no matter what you do, you can't fix everybody. Not everybody's going to have a great outcome, but you have to remember that you were put here for a purpose, and your training and everything is to help people. And while you can't help everybody, you got to get back up on that horse because there's lots of people that need help.
Absolutely.
Yeah.
I think that that point is great because even as a nurse in the ICU, we struggle a lot with not fixing things So like you said, we can't fix everything. And you as a surgeon saying we can't fix everything, I think that resonates with me because we really try hard in the ICU to make sure that the patient, from the beginning pre-op all the way to their them getting discharged, that they do very well. And when we get those patients that don't do well, that we couldn't fix, that we tried, and we just our everything still was not enough. We struggle with that because just like you are a perfectionist in your craft, the nurses in the ICU are perfectionists in their craft as well. So I think that a lot of nurses will appreciate that statement that we can't fix everything.
Yeah.
Well, and it's tough. I mean, for the same reasons I was drawn into this area of surgery, that's why you were drawn into that area of nursing. And, I love to brag on our nurses, and Cassandra's, one of our best nurses, I will tell you. I know you know that because you're married to her, but she's fantastic. And, it can be easy sometimes for the surgeon to come in, do their job, come talk to the family and leave. But Cassandra and all of her colleagues are the ones at the bedside, literally changing medicines minute to minute, doing all of the things that need to happen. And the families, and it goes both ways, because if the families are upset, we hear that they're upset, but, not that we hide, but we can hide places and things like that. But there's no way that they can hide because they're right there in the room with them the whole time.
Right.
Yeah, exactly.
We have to deal with the complaints. We have to.
Exactly.
We get a lot of family members that think the surgeons are accessible. Like we can just grab you and we're like, they're in surgery.
They're busy right now. Yeah.
I hear a lot of the stories. Half the time I have no idea what you're talking about. But I hear a lot of stories and I'm just like, oh, what? They said that. But I've dealt with it too, especially, when I was a police officer, it was a lot of, dealing with families or, people upset and, being kind of that middleman.
Oh yeah, yeah.
And and our higher ups, like a captain or somebody, people feel like I want to talk to this, and I'm like, I can't just.
So do I. If I can get a hold of them.
Yeah, but I can't just call the chief and be like, hey, somebody wants to speak to you real quick.
Sure.
So I definitely understand that. So I also want to know about the Ferrari stuff.
Oh,
we got to get into
really
that.
what he wants to really.
Sure.
Surgery and then Ferrari.
First off, can I borrow it? No.
Sure. Anytime you want.
But yeah, what's that? Are you always like into cars and?
So I was sort of always into cars, but not that kid that had every model of the car and was like couldn't wait to do it or whatever. And it was really a couple years ago, I started getting into cars, and some of that was watching racing on TV. Others of it was in the community, people wanting to drive cars, doing track events and things like that. And so my first foray was with BMW. So the car I took today was the M8, which I love.
It's not too shabby,
yeah. No, it's a great car, and I'm blessed, first of all, to be able to do this. I recognize that, but that car was sort of the first car that I enjoyed driving. And, that's a sedan, and I got it because the kids were younger, and it was a great car that we could take the family around in, but I could also have fun with. And my dream was always to get a Porsche, always. And, as fate had it, there was a beautiful car here in Hampton Roads, and I told my wife, I know it's ridiculous, but I really, really, really want this. It's going to be fun. It's going to be fun, Corvette. And you're going to exactly. Oh, you should. And actually, we'll talk later. There's one for sale that I think you would love.
Okay.
But I really want to do this, and so she said, "Okay, I'll make you a deal." And I was like, okay, anything. She said, and this was at the point where I was my heaviest and my most unhealthy and everything. She had been wanting me to do Weight Watchers and get back into working out and all that kind of stuff. And she said, I'll let you get it, or I'll support you getting it, if you agree that we as a team are gonna get back into shape. So I did. I signed up for Weight Watchers. I started working out, started being accountable, and it was nice because there was some skin in the game for me to do it, right? And then one of the other issues is, we live in Norfolk City, and the neighborhood we live in, there aren't garages, right? And so I needed to find a place to park these cars when I'm not driving them. And so I got with a guy who, stores cars and whatnot. And it's just a whole community that I've gotten to know through that individual, which has been fun. So getting to know other car enthusiasts and, their likes and, swapping stories and swapping cars and things like that. But what really got me into it was the high performance driving events at tracks. So there's an unbelievable track that I didn't even know about till I got into this. It's in Danville, Virginia. So it's 3 hours west of here, Virginia International Raceway. And almost all the car clubs have days where even novice drivers can go out and they pair you up with an instructor and they take you around the track and basically show you how to drive the cars. It's not racing. There is some danger to it. You wear helmets and all the protection and all that stuff, but you really get to push these cars far more than you can or far more than you should on 264 or any of those other roads. And to me, it's just such a thrill. It is just such a thrill to do that. And it all kind of gets back to surgery where it's all very prescriptive. It's very mechanical. When you're going into a turn, you have to be going a certain amount. You brake at a certain place. And I liked it too, because these tracks are set up where they'll have 3 or 4 turns in a row. And you have to hit the first turn perfectly so you can hit the second turn perfectly so you can hit the third. Right. And if you miss the first turn, you're not going to be able to get the second or third. And I don't mean you're going to crash your car. You're just not going to be able to go as fast. The car is going to slide, things like that. So just like, in training, we, strove for perfection in our cabbage or our, bypass surgeries, did the same thing on the track and just absolutely love those days. How I got into the Ferrari was I did always have a dream to have a Ferrari too.
Of course, me too.
I wasn't looking for one, but one came up, and that was a harder sell for my wife. she said, you said that about the Porsche. Now you want a Ferrari? I was like, look, there's not going to be another chance. It was from a reputable dealer. It's like, relatively good in terms of mileage and everything like that. Just please let me do it. And I said, oh, and by the way, it's a convertible. And that's, I think, what kind of sold her on that.
I work on hearts.
Exactly. Well, I mean, some of it's work hard, play hard too, and that's kind of my release. I will say, coming out of training where you have almost no time, all of your friends are in the hospital. And that's not a bad thing. I've got great friends that I've met, nurses, respiratory therapists, other surgeons, everybody in the hospital. But my wife had always said, I really want you to get a group of friends outside of the hospital. And I've got some of those here, but this has kind of been, one of my groups outside of the hospital. And it's kind of nice because, Gina and I will do a lot of things together, but, she likes cars, but doesn't like cars, right? So when I do these things, it's, me and the guys, and there's certainly plenty of women driving Ferraris too, which is fun. But it's nice to have another group of people where it's completely separate from the hospital, but where I can also sort of enjoy and improve. And, that's kind of been my hobby.
Nice.
Yeah.
Nice.
Yeah.
That's pretty
now
cool.
He's going to want to join the club.
You should, my friend. I'll get you hooked
I've been
up.
wanting to get this Corvette for a minute. And I've been looking, and I'm
cars.
like right there. And she's like, you do it right now? Do you got to get it? Yes.
I'm on the same boat with Gene.
Yeah.
Okay, I want a Corvette. Okay.
They're awesome cars, and they're only getting more and more powerful.
Yes. Yeah. The new ones like 2020 and up are nice.
Yep.
Especially the convertible ones.
Yep.
Yeah.
How did you get into cooking? Because you do a lot of fine dine cooking at home. And you have a beautiful kitchen that you got renovated and done just for,
For that, yeah. So that's an interesting story. And there's a lot of parallels with cooking and surgery too. So I've growing up, my mom I was in a very traditional household. So, mom did all the cooking and things like that. And I always loved to eat. And part of that was, you're at soccer practice and you're ravenous when you get home or basketball or swimming, whatever. And so I kind of got interested in, helping my mom in the kitchen and things like that. Then, fast forward, you go to college, you're in a dining hall. And then I got out of college. I took a gap year between college and medical school. I was working in medical research. And all of a sudden it was, I guess I have to cook for myself because there's no dining hall. Mom's, 2 hours away. I got to do this. And it was right when Food Network was was really popular. It was year 2000, 2001. And it was also when, do y'all remember TiVo?
I don't think so.
You may be too young for that. That's okay.
But that's when you can record the TV. Yeah.
Yes.
I remember. We didn't have that. I didn't have cable growing up. But but I remember that was like a cool thing.
So it was amazing because growing up, my brother and I would VHS tape, VCR tape everything we wanted. But TiVo was revolutionary. It's basically, what you can get in your, Cox box right now. But the ability, like you said, to digitally record anything you want and fast forward was crazy. So when I went to work, I'd have it just tape Food Network, right? And then I'd get home, and I remember Emeril was really big, right? Both because he's just a personality and he cooked really interesting food. So I would tape his shows, and then I would start, basically making a recipe along with him. And then I got into, I love to read. So there was Bon Appetit and Gourmet magazine. So I'd get those, and a lot of those recipes are very easy to do. And I will say, for people that don't like cooking or are intimidated by it, you just got to try it, right? And like anything, right? The first time you ride your bike, you're going to fall off. The first couple things I made, I think, were terrible, right? But my roommates were like, "Oh, this is good. Thank you for making us dinner," and just kind of really got into it. And then there was a book, and I'm blanking on the name, but it's basically about like love languages and how everybody expresses their desires for other people. And, I realized mine is providing for other people. And so for me, cooking was a way where not only do I enjoy it, but I could provide for other people, and, seeing the enjoyment on their face, when I make something is just amazing. And, my wife and I met in medical school. I broke my only rule, and that was I didn't want to get involved with anybody in the medical field because I didn't want to be, that couple. And my wife and I actually met the very first day of medical school, actually even before medical school on our orientation trip. But, as we started dating, one of the easiest things I could do, because we both have to eat, is I'm going to cook for you, right? And at the time she was a vegetarian, and she's like, well, I don't know if you're going to be able to do that. I was like, well, watch me, we'll do this. I don't have to eat meat every day. And so started doing that, and then just got really, really, really into it. And, started getting more complex, started, keeping my own sort of like notes and things like that. Or we go to a restaurant and I'd try to deconstruct whatever was going on. We went to med school in Nashville, which is a fantastic food town. And over the time, I sort of made my own copycat recipes for lots of things. And, it's just fun. It's just fun to do. And then, fast forward till now, the house we live in is from 1905, and the kitchen hadn't been renovated since like the 80s. And, things were starting to go, the refrigerator, the oven or whatever. And rather than just replace one or the other, we said, okay, well, we'll save up. We'll take our time. We'll plan exactly what we want. And so that's what I did. I, made myself a kitchen where I can cook the way I want to. We have a little setup with an island. So like the kids and can be there playing a board game while I'm cooking, or people can watch or help. And, I love it too, because now I can get the kids involved. Right. My college roommate, he had kids before we did. And when we had kids, we said, how in the world do you get them to eat food? Because, kids just want mac and cheese and chicken nuggets, which I can eat the heck out of some mac and cheese and chicken nuggets too, but want them to have like a palate. And he said, we have a concept of a no thank you bite. I was like, what's that? And he said, they don't have to eat it. They just have to try it. Right. And he said, more often than not, the kids will, thumb their nose at something. They'll take a bite, and they may not admit it to you, but they like it. And then before you know it, the plate's gone. So that's what we did with our kids. And we eat all kinds of different foods. And my wife and I like things spicy. And certainly when the kids were younger, we wouldn't do that. But, we would expose them to, I'm going to cook Indian tonight, or we're going to get Thai food, or this is this kind of food. Right. And it's really gotten them into liking different foods. And my daughter now, her favorite food is Korean. She loves Korean food.
Like Korean barbecue stuff?
Anything and everything. Korean noodles, Korean dumplings, Korean barbecue, all that stuff. And so then what I did was I had each of the kids, pick out a cookbook. And so we bought it. And so I bought a Korean cookbook for my daughter, who's the one that actually likes to cook a bit more than my son. And I said, okay, you can go through this and you pick out 3 recipes, like an appetizer, a salad, and a main. And then we'll go to the store and we'll shop, and then we'll come home and you'll help me. And it's been a lot of fun to do that. I would say I'd love to do that every weekend. It's kind of been sort of hit or miss with how busy we all are. But I think getting them involved in it and frankly, teaching them, you're going to want to learn how to cook, right? Yeah. I tell my son, It wasn't the only way I wooed my wife, but it certainly was a bonus that I could cook.
Right.
And teaching my daughter, hey, you're going to be living on your own at some point. You like this Korean food? Like, let's figure out how to make it and let's do it. Sort of teach them another skill. But what's crazy for me, and people don't understand this, including my wife, I could have the hardest day at work, but as long as I have the ingredients to make something, I will come home and I'll just go in my Zen mode and I'll cook. And it's not like I cook, 9-course meals after a busy 2-operative day.
Right.
It seems like it though. I've seen roasted duck and homemade hot sauce.
Now, those I do on my days off.
Okay.
Those I do on my days off. But, what I love is the challenge too. And I'll have this, my wife hates that I have like so many condiments and so many ingredients in the pantry. And so I've challenged her. I say, okay, you pick out a couple of ingredients, kind of like the show Chopped, if you've ever watched that. Pick out a couple ingredients and I will make something with that. And so I kind of like the challenge of doing it. But, again, much like surgery where there's a protocol and there's a way you follow. There's a concept in cooking called mise en place. And that's get all your ingredients out. Chop everything up, get it all ready to go so that way when you cook, it's just add this, add that, add this, and it's done. And it's a lot of prep work ahead of time, but I love it. And I do get to use knives, so that's very similar to surgery, I suppose, as long as I don't cut my fingers. But yeah, no, I love it. And, my favorite times of the year are when family's together. My favorite holiday, to be honest, is Thanksgiving.
Thanksgiving's good.
I love it because it's not, I love Christmas too, don't get me wrong, but Thanksgiving's not commercial. We always did something where, we talk about what we're thankful for. So we go around, it's family together, it's food, it's just, a day of rest and relaxation. And so when I can, we all have to take our turns working holidays. I love Thanksgiving and I will prepare a week ahead of time. And no, I will. I'll make my own turkey stock. Get the turkey. Figure out. There's some tried and trues that we have to have, and I kind of like it because we combine our two families' experiences.
Right.
So we've got some of the dishes from Jean's family, some of the dishes from my family, and then I keep a running log of interesting things that I want to try to make, and so we'll have a little bit of everything, right? And it's just fun. I love doing that.
No, it's same with us. I really can't.
Cook.
Yeah, I can't cook. I ain't gonna lie, I can't cook. I just my
cook.
brain doesn't work
He doesn't
on like
have the attention
yeah.
span.
But she is really good at cooking.
Oh, that's awesome.
Yeah.
She is great at it.
I
and
haven't ventured
help
out to any different type of I'm not I won't go into different cultures like Indian or Korean. I think it's intimidating to deal with different flavors and spices and stuff, but I do like to cook and I like to be same way, I don't play music. I'm very focused. I don't want to be bothered. I clean and cook at the same time.
Oh, that's so there's not a messy kitchen.
Yeah,
That's like her whole thing. I can't even talk to her at the time. She'd be like, "Get out, move."
So that is I think I use that as well as a time for me to kind of just decompress and kind of meditate in a sense.
It is.
It's a form of meditation for me.
It is, and I love to let her have her time. And it's good food. It's good food. One thing, she is a very good cook.
Yeah, and you do have to have the patience and things like that. He does not have the patience for.
I don't. Everything for me
rushing.
is just go.
Quick, easy, and that's him. But
we have a nice division of labor that way too, because Jean hates a messy house. Not that I love one, but she will take care of a lot of that stuff, and I clean as I'm cooking too, so it's not crazy. But when we have people over, she loves to host and she loves to entertain, so she's the one getting all the flowers there and making sure all the pillows and everything are good and entertaining while I'm cooking.
Yes.
But it's just a nice combo together. The one thing I'll say I'm proud of is there's only one thing I've made, and we've been together, 25 years now. Only one thing I've made that she does not like and doesn't want me to make again.
What is it?
So do you remember Rachel Ray?
Yeah, I remember.
So Rachel Ray had 30-minute meals. That was another one I did because that's super easy to throw together. It's going to sound funny, and I'm telling you it's delicious. A chicken cacciatore sandwich.
They don't make that where we from. They don't do that.
I mean, it's basically chicken and onions and peppers in a tomato sauce on a roll with melted provolone cheese. It was delicious, I will say. And that is the only thing she hangs her hat on. I'm not going to make it. So my kids now have said, your job is to remake that recipe so that mom likes it.
That's funny. But look, I just want to say thank you for taking the time away from, fixing broken hearts and coming out and talking to us.
You're welcome.
Where me and her been together since we were 13 years old.
Okay.
And we from South Jersey in the middle of what one's called the hood. And there is no heart surgeons where we're from. And to be able to sit down and talk to a heart surgeon is just amazing. And I really appreciate the time.
It's a lot of respect.
It's a lot of respect in there, and just to see where we come from, and to be able for my wife to say, hey, I'm going to reach out to this cool surgeon I know. And we're going to sit down and talk. She always brought you up. So I was like, absolutely. Like, I want to talk. I feel like a little kid. Like, I want to know, how's his heart work? Yeah. So I really thank you. For the opportunity.
You're very welcome. It's an honor and a pleasure to do this. This has been a lot of fun. I now get to tell my kids I was on a podcast, which they're going to love.
Yeah.
They're going to love it, especially watching you on YouTube and stuff.
That's right.
They're going to be like, oh, this is all right.
That's my dad.
You'll get some cool points.
Yeah, you got some aura.
Hopefully, I need to because I'm the dad,
Aura, that's what the kids say
they
now.
say you got aura. Yeah. So thank you, man.
You're very welcome. My pleasure, Jerome. It's great to meet you, too.
And thank you again. Like he said, I'm very appreciative of you coming on our podcast and taking the time out and kind of showing people the human side of the surgeon. He's not scary, y'all.
We are approachable, I'm telling you.
You can have a conversation. And I wish we could have more time, but we're going to cut it a little short, and maybe in the future we'll have you again.
We can do another one.
Definitely.
And,
part two.
For sure.
It was a lot of good.
Because I want to ask you about aliens and all types of stuff next time.
And we didn't talk about the drones.
Oh, yeah, that's right. Yeah. Or we can go into something like heart transplant, something fun like
Absolutely.
that. Yeah, let's do that.
All right, next time we will.
All right.
Yeah.
Thank y'all for tuning in. See you next time.
time.
All right.